Hello, good day to you all. My name is Afam AJ Charles Jr., taking you for patient and family care study. Last time, we talked about the introductory bit to the patient and family care study and chapter 1, making model 1. Today, we'll be moving on to model 2. Model 2, we'll be talking about diagnosis or identification of health problems, analysis of data. That is chapter 2. In care study, we are using the nursing care approach, nursing care plan approach. And that there are 5 models under that. And the second one is analysis of data, or diagnosis of the analysis of the data. So here we will be comparing what we have in literature review to what the patient exhibited, be it laboratory investigations, be it pharmacology of drugs, be it the courses, etc. We'll be comparing. So this is model 2, as I said. We'll start with the analysis of data. An analysis of data, there are components under analysis of data. So we start with a comparison of data with standards for the diagnostic investigations. That will be table 1. Causes of the client's condition or the patient's condition. Clinical features. And the clinical features, we'll be comparing clinical features in literature review to clinical features exhibited by the patient. Then that will be table 2. And we'll go to specific medical treatment. Specific medical treatment or surgical treatment. Then we'll move on to pharmacology of drugs. Pharmacology of drugs will be table 3. Then complications. After complications, we'll move on to health problems. We have to identify some health problems. The patient is obviously not well, and he or she will be exhibiting some health problems which should be managed. Every patient somewhat has some strengths which would help in the management of these health problems. And after all this, we would derive nursing diagnosis from the health problems identified. That would end module 2 and chapter 2 as well. So to start with the diagnostic investigations, you would have every patient will, when admitted, will be asked to do certain diagnostic investigations, laboratory investigations. It can be full blood count, blood urea electrolytes and creatinine, hemoglobin level estimation, chest x-ray, abdominal ultrasound, MRI, etc. There are a number of laboratory or diagnostic investigations that can be requested for the patient. In this case, if you have a patient and they request these diagnostic or laboratory investigations, in starting your chapter 2, after explaining what analysis of data is and how you are going to analyze your data, you move on to the next component, which is comparing of data with standards. Comparing of data with standards. And to do that, you start with diagnostic investigations, as we said. So we'll move on to the table quickly. Before you have listed all the diagnostic investigations requested for the patient, you start. So the first component is date, as you can see there. The date is when the diagnostic investigation or the laboratory investigation was requested. So you have to write that date there and not when it was done. So the date, it can be requested, let's say, on the 19th of May 2020, but will be done maybe on the 25th. So it was when it was requested, the requisition date, when, let's say, hemoglobin estimation level was requested. So you put that date there. Then you move to the specimen. The specimen is what you will be taking to do the request. So let's say in hemoglobin, and we know hemoglobin is blood. So we need some blood to check the level of the hemoglobin in the blood. So same goes, the specimen is blood. In chest X-ray, we are taking the film of the chest. So the specimen is the chest. Under abdominal ultrasound, we are viewing the contents of the abdomen. So the specimen is also the abdomen. For another example is let's say you have a fracture, a femoral fracture, a break in the continuity of the bone, and you have to do an X-ray of that part. Then you mention that part. So if there's a break in the femur, the specimen becomes the femur. If there's a break in the ankle, the tibula or the fibula, then you mention that specific part. If you do an MRI or a CT scan of the head, then the specimen becomes the head. I hope you understand it now. Then we move to the results. So when the investigation is requested, the results will come in, and it will be printed or on the system if the hospital is gone electronic. So you'll see the results there. So here, the result is 6.9, and the normal value for hemoglobin estimation level is 12 to 18 gram per deciliter. So you can see that it's below normal ranges, and that is for the interpretation. It's below normal ranges. So when you move to remarks, then you know that the remarks is the intervention you do for the results that you identify. So now we know that 6.9 is low. So what do? We have to give either hematinics, normal saline, and also or blood to improve the levels of the blood. So we give normal saline, we give hematinics, and we also give blood for the remarks. So you write what was done for your patient in this case to increase the hemoglobin estimation level. Hemoglobin estimation level is normally requested when we want to do, let's say, a surgery for a patient. In surgeries, we have to know the hemoglobin estimation level so that when patient goes into, and the hemoglobin estimation level has to be within normal ranges before patients can go into surgery. Because in a surgery, the patient will lose a lot of blood, and i.e. patient losing blood and the hemoglobin estimation level is 6.9, it means he or she losing blood would reduce this drastically, and the patient can lose his life due to hemorrhagic shock. So after doing this and giving the hematinics and the blood, hemoglobin estimation level has to be rechecked until you get the normal value, the results being in the normal ranges before we can proceed to do the surgery. So in the case of a surgery for hemoglobin estimation level, it will be rechecked and done. So the same goes for chest X-ray. Chest X-ray, the results, you found an opacity in the lungs. That is some form of light in the lungs. The lungs are supposed to be clear, and you shouldn't see any darkened space in a chest X-ray. So that is also abnormal. And is abnormal, there can be fluid or substances in the lungs. And with that, we would have to give antibiotics to clear the fluids in the lungs. So that is it. I hope you understand the illustration with diagnostic investigations. Now moving on to statement of comparison. So after you are done with the diagnostic investigations, you have to look at the statement of comparison. So you indicate whether all, few or none of the diagnostic tests stated in the literature review were done. So sometimes you realize that some of the diagnostic investigations requested for the patients end up not being done, or some are done due to a number of reasons. Whether there is a backlog of, there are too many patients there doing the same test, or the patient has financial constraints which might impede him or her from doing these tests. So you have to state in your write-up, let us know that these tests were done and these weren't done, or if all were done. So that is a statement of comparison. Under courses, with reference to the textbook courses, you state the factors that brought the patients to the ward. So in your write-up or in your literature review, you have certain causes of the disease condition. What causes the disease condition? There are a number of things that cause certain disease conditions. So let's say in a fracture, it can be caused by a fall or in a road traffic accident. So let's say if your patient's condition is fracture, you have to state that it was caused by either, let's say, a road traffic accident or a fall. That is for the causes. Then to clinical features. In clinical features, you are comparing all the clinical features exhibited by the patient to those outlined in the literature review. In your literature review, you come up to state the clinical features in your textbook. So you are comparing whether the patient indeed exhibited some or all of them. That is for clinical features. And clinical features is table 2. So following, you see, so the title of table 2 is comparison of clinical features and literature review to that exhibited by the patient. And the headings are clinical features in literature review and clinical features exhibited by the patient. So you have to state clinical features in literature review in sentence form. So for example, there will be chest pain. And for clinical features exhibited by the patient, you also state them in sentence form, saying that patient exhibited chest pain. Many a times you find out students writing for the clinical features in literature review column, they just write the clinical feature, which is, for example, chest pain. They just write chest pain and not patient will exhibit chest pain or patient will have chest pain or there will be chest pain, just chest pain. And in clinical features, they end up also writing absent, present. No, we want to know patient exhibited chest pain. It has to be in sentence form. Another example is patients who have dyspnea. Dyspnea is difficulty in breathing. And the corresponding side of the table should also show that patient did not have dyspnea or patient did not experience dyspnea. Moving on to treatment. There are types of treatment. So taking the literature reviews, medical and or surgical treatment into consideration, we have to specify the kind of treatment that was ordered for the patient. So in this case as well, depending on your condition, you have to state the type of treatment that was done, that was given to your patient. So in surgical treatments, you have to indicate the name of the surgery done and the type of anesthesia given. You have to state the name of the surgery done and the type of anesthesia given. So for example, you can state that the name of the surgery was appendectomy and the type of surgery given is general surgery. Depending herniorrhaphy, and there are so many types of surgery depending on the type of condition your patient has. Moving on to medical treatment. In medical treatment, we use normally drugs. So you have to list the drugs, and these drugs include infusions and oxygen therapy. So you have to state all these things. So you list the drugs, including infusions given to the patient and their dosage. So for example, we list it in its entirety: tablet paracetamol, 1 gram, 3 times daily for 5 days. TID is 3 times daily. So you've done pharmacology, so you know this. You state it in its entirety. Don't write shorthand, tab, PMOL, 1 gram, TDS. Write it, let's make sense. Write the full thing so that we know that you are talking about tablet, PMOL, 1 gram, TDS for 5 days. Then we move to pharmacology of drugs. Under pharmacology of drugs, we've done pharmacology. We want to know the date the drug was ordered. We want to know the class of the drug. We want to know the drug's name itself. We want to know the mechanism of action. We want to know the actual, if the drug, the desired effect of the drug, the side effects, and also if there were any side effects, how you managed them. So under pharmacology of drugs, pharmacology of drugs administered to the patient include oxygen and intravenous fluid and should be tabulated as follows. So what you see from the table here, there is the date. The date is when, so you pardon me for the shorthand. You see from my table, I have some shorthand, tab, PMO, and all that because of the space allocation. But in your write-up, you are supposed to write it in full. So tablet PMO was when, the date 19th May 2020 was when the medication tablet PMO was prescribed. So you have it there. Then the drug itself is tablet paracetamol. Then the dosage and route of administration. The dosage is 1 gram. The dosage is TID for 5 days. The duration is 5 days. Then it's an oral medication. You can have intravenous paracetamol, which can be given, which can be 1 gram stat, or intravenous paracetamol, 1 gram TDS for 24 hours. And if it is intravenous, the route of administration then becomes intravenously. You can have certain medications like insulin, which makes that one subcutaneously, or heparin, which makes it subcutaneously, or rectal medication, suppository paracetamol, which makes the route rectally. So you also go on to state the class of the medication, and paracetamol is an NSAID, a non-steroidal anti-inflammatory drug. Then the action or the mechanism of action for paracetamol is it may block pain impulses and inhibit prostaglandins in the central nervous system. Then the actual action observed or seen, the patient's headache and body pains will reduce or have reduced. Then the side effect of tab paracetamol is liver damage, and we didn't see that in the patient. So for the remedies, as I said earlier, we talked about how, that talks about how, if there were any side effects of the drug, how they were managed. So that is for pharmacology of drugs. There are so many drugs, so you state and you have tables for all the medications that were administered to your patient. Then move on to complications. So with complications, with reference to the complications stated under the literature review, you state the complications the patient developed and how they were managed. So for every condition, there are complications. You have to state if indeed your patient exhibited any complication and how you managed them. That's for complications. If the patient didn't exhibit any complications, you just write that patient did not exhibit any complications. Then we move on to health problems. Health problems, every patient has health problems. Patients that are used for case studies obviously have health problems. That is why they are there to be managed. So you have to have the ability, you've been taught on how to identify health problems. Health problems can be actual or potential. So in identifying health problems, some can be derived through observation and also others from the patient. So the patient can voice out certain health problems. Some of them are also obvious. For example, if a patient has a chest tube which is draining, it is a health problem in itself. The chest tube has to be cared for to prevent infection, and there has to be continuous drainage. So it's a potential problem. Actual problems are there when patients tell you that they are in pain. As McAfee said, pain is what the patient says it is, when he says it is, and how It's all there. So there can be actual or potential problems. So health problems must be stated in simple terms and avoid using nursing diagnosis. Health problems. So, for example, you find out that some students use, instead of saying patient cannot breathe well, they prefer to use dyspnea. Dyspnea is a nursing diagnosis and not a health problem. So it has to be stated in sentence form. So, as I've stated examples there, patient cannot breathe well, patient is vomiting, and patient is likely to be dehydrated. Patient is likely to be dehydrated is a potential problem. It hasn't happened yet. That's what makes it potential. But actual problems is when you can see that patient is indeed vomiting. Patient is indeed dyspneic and cannot breathe well. So you manage these problems. And strengths. Strengths are things or what you can do to help solve the problem. That is a strength. And the strength may include healthy healthy physiological functioning, emotional health, cognitive ability, coping skills, interpersonal strengths, presence of support persons, adequate finance, and healthy environment. So these are all forms of strength, how the patient can help solve his or her problems. And the patient's strength must tally with the patient's problem. So what I mean is, if your problem one is patient cannot breathe well, then your strength 1 should match problem 1, making strength 1 patient can tolerate prescribed oxygen, which makes it tally. So problem 1 must match strength 1. Then to nursing diagnosis. To nursing diagnosis, the identified health problems are developed into nursing problems. So as we saw from the previous one, breathing, patient cannot breathe well, but the nursing diagnosis for it is ineffective breathing pattern related to pulmonary congestion. So the one for vomiting becomes vomiting related to irritation of the stomach or GIT disturbance. And risk for fluid volume deficit is also related to persistent vomiting. That is for nursing diagnosis. And nursing diagnosis is derived from NANDA. NANDA is the North American Nursing Diagnosis Association. And every year or every 2 years, they review what they have. So I'm sure that by now, every year or 2 years, there is a new NANDA, which you are expected to follow and to use. So I suggest that you find new NANDA, download it from the internet and use it. But with the problems and the strength I stated earlier, these are the nursing diagnoses. We've come to the end of Module 2, and my name remains Afam Eje Charles Jr. I work with St. Carol's School of Nursing, and I thank you for your attention.